The Philippines set new highest single-day COVID-19 recoveries at 4,325. Based on the latest case bulletin of the Department of Health, the number of patients who survived from the disease rose to 20,371. The DOH also announced 65 more fatalities, pushing the death toll to 1,599. Meanwhile, 836 more people have caught the virus, bringing the total of infected to more than 57,000. With these numbers, the active cases or the net of COVID-19 deaths and recoveries significantly decreased from 38,000 to more than 35,000. According to Yusek Maria Rosario Vergere, more recoveries and deaths are expected to be reported in the coming days as a result of the agency's data reconciliation efforts in cooperation with local governments.
The increase has been gradual and our health system is able to cope with the increasing number of cases. This is reflected in our indicators. As of July 12, our case doubling time is still at 8.18 days. This means that it takes more than a week for the number of cases to double and have enough resources to address the current needs.
But according to Health Undersecretary Leopoldo Vega, the critical care capacity for intensive care unit or ICU beds in the country have reached its danger zone.
The capacity right now, the critical bed capacity, especially for the ICUs, according to our data, nasa danger zone, in more than just about mga 70%. Meron pa ring kailangan na tugunan, and we have to make sure na if ever there is a rise in the number of severe and critical patients, kailangan maka-adjust ang mga hospitals.
In an advisory, Makati Medical Center revealed that it already reached full capacity. It further stated that MMC's COVID-19 zones, both the regular wards and the critical care units, and especially the emergency room, are now full. It, however, assured to help patients find another healthcare facility. Yusek Vergere admits that while more hospitals declare full capacity, it still has to be interpreted cautiously.
Kailangan, we have to interpret this cautiously. Katulad ng ipinapaliwanag namin sa inyo nung isang linggo pa, when a hospital declares that it has full capacity for COVID beds, kailangan tignan natin, nakarating ka ba dun sa 30% na target natin?
On the other hand, Yusek Vergere assured there are enough beds and facilities for COVID-19 patients who are asymptomatic or mild. Meanwhile, as COVID-19 infections in the country continue to rise, the palace named Baguio City Mayor Benjamin Magalong as tracing czar, Public Works Secretary Mark Villar as isolation czar, and Health Undersecretary Leopoldo Vega as treatment czar. They will work together with National COVID-19 Task Force Chief Implementer Carlito Galvez Jr. and testing czar Vince Dizon in the government's effort to fight COVID-19. Mark Fetalco for The Nation.